Welcome to Checking In, a Scottish Rite for Children podcast, where we'll share up-to-date expertise on children's muscles, joints, and bones. Scottish Rite for Children is one of the nation's leading pediatric orthopedic centers. Since 1921, we have been committed to caring for the whole child, mind, body, and spirit. Today, our world-renowned medical staff treats a wide range of pediatric orthopedic conditions, including sports injuries and fractures. Our specialists also excel in the treatment of related arthritic and neurological conditions, as well as learning disorders like dyslexia. Through outstanding care and compassion, Scottish Rite has become a place of hope. We are dedicated to beating the odds in the face of adversity because it's our mission to give children back their childhood. And now, your host, Brandy Schmidt.
Hi, I'm Brandy Schmidt, and I'm a clinical program coordinator at the Scottish Rite for Children Orthopedic and Sports Medicine Center in Frisco. Welcome to Checking In. I'll be your host today as we discuss sport-related concussions in young athletes. Today, we are checking in with pediatric sports medicine physician Dr. Shane Miller and athletic trainer Josh Stevens. Welcome, Dr. Miller and Josh. Thanks for joining us today.
Thanks for having us.
Glad to be here.
I'm excited about our conversation today. We've been working together for a while now, so I know you both pretty well. But let's give the audience a little more of your background. Dr. Miller, can you tell us about your path to pediatric sports medicine?
Sure. Growing up, I played a lot of sports and was a competitive young athlete and enjoyed my time doing that quite a bit, but also experienced injuries. And some of those took me away from sports that I loved for a period of time. And I had a family member who was an orthopedic sports medicine physician who took great care of me and inspired me to pursue this field. So from a young age, I had exposure to sports medicine and realized that was a career that I could do when I was no longer competing and being as competitive in my adulthood, but could still be engaged and interactive with the young athletes and trying to help them get back to doing what they love.
Josh, your early career was in collegiate and professional sports. Can you tell us how that prepared you for your role here?
You bet, Brandy. I really enjoyed my time working in the college setting. One of the coolest things about that was I worked with a variety of different sports. I worked with athletes from all over the world. I got to meet people with different backgrounds, different reasons for why they were playing sport, different passions, different goals, and different life stressors. It taught me how to relate to people, and communication was key. And I think those things have carried with me, and I think they're really, really important aspects of being an athletic trainer.
I'm guessing there's a few people listening that don't know what an athletic trainer is. Josh, can you give us a little bit of background on that?
Yeah, an athletic trainer is a healthcare professional. It's required to have a bachelor's degree. Most have a master's degree now. We're transitioning to that setting. And then you also have to be licensed or credentialed by the state and our nationally governing board. And so, we are healthcare providers that basically our role is to prevent where we can injuries, to manage and evaluate injuries as they come up, and to refer out things that are, that need to be evaluated by physicians.
Something I think everyone should know is that both of you now have kids of your own. I'm sure that may come up as we talk today. Josh, what do you think that does to prepare you as a pediatric sports provider?
I think we can all agree that this whole parenting thing is hard. There's challenges. There's so much unknown that goes into it. And to be able to have this aspect of sports medicine where a family is coming in to see us with the unknown, they don't know what's going to happen next with their child. And for us to be comfortable in that setting and be able to communicate a plan, it helps me be a better provider because I know this area very well, but there's other areas where I know I need an expert to help me get through that situation, to provide the best for my child. And so knowing that going into the room helps me to communicate better and to help those families along.
My kids are a little bit younger than Josh's, but I think one of the biggest compliments that we can receive is being entrusted with the care of someone's children and their family. And having been there as a parent myself, whether you're having a medical issue or something else that you're seeking care for your child, you really are trusting them to provide you with the very best. And I think that being a parent allows me to have been in that situation and been in their shoes, so to speak, and provide compassionate care.
Well, I know a lot of people trust both of you with the care of their kids. You guys have taken care of thousands of kids with sport-related concussions, which is what we're here to talk about today. Can we start with getting a basic understanding of what a concussion is, Dr. Miller?
A concussion is a brain injury. It's an injury that causes problems with the way that the brain works or functions, typically caused by a blow to the head or a blow to the body that causes the brain to shake within the skull. To concuss means to shake. And symptoms typically develop relatively soon after the injury itself and will gradually get better with time and eventually be able to return back to normal activities.
Josh, what are some common scenarios that patients come in and describe?
The most common scenarios are a contact or a collision with another athlete, whether that's in soccer going up for a header or in football, going head to head, making a tackle or head to shoulder, something like that. And the other one would be, contact with a fixed object, whether that's the, head to the ground, taking a charge in basketball, running into the side of a goalpost or something like that, or the goal in soccer.
We also see a lot of injuries that occur outside of sports. An athlete that may be at school or maybe they're on vacation and there's a fall, they hit their head, or maybe they're at school and they stand up and hit their head on the locker or underneath the desk. And so we can see concussions occur in all different kinds of daily life scenarios as well.
Why are concussions more of a concern in kids?
Children's brains are still developing, and they can be until even after high school. They're still developing. And because of that, we think that there's a greater risk to the brain and also perhaps longer recovery.
So it sounds pretty important to recognize a concussion when it occurs. So what are some things that you're looking for maybe on the sidelines?
Yeah, so that's the challenge, right? So when you're covering a sport on the sideline or watching a sport on the sideline, the twist of an ankle, that a kid collapses and grabs their ankle, or they twist a knee and they fall down and they grab their knee, those are easy things, right? Those things stand out. Concussions are a lot harder. One of the terms that Dr. Miller uses in clinic is you can't see the brain limp, and I love that because it puts a good picture to things. And so you've got to be vigilant and keeping an eye out for these things. And so you're looking for any kind of collision that somebody kind of gets up from and they're staggering, they kind of seem off balance or whatnot. But you've also got to pay attention to just the athletes in general. If a kid comes off to the sideline and they're staggering or they're wincing because the light seems to be bothering, or they're clutching their head, or they seem off, those things are important to pay attention to. Also, some other athletes may say something about their hey, so and so doesn't seem right. And you got to take all that stuff very seriously and go over and kind of dive deeper to see what's going on there.
We'll be right back after this.
To learn more about sport-related concussions, visit scottishriteforchildren.org/concussion.
Welcome to Checking In, a Scottish Rite for Children podcast with your host, Brandy Schmidt.
Dr. Miller, how do you diagnose a concussion? So we just talked about recognizing some signs and symptoms, but what do you do to diagnose one?
Typically we start with the history, finding out exactly what happened. When there's typically been some sort of an injury and the symptoms developed fairly quickly and soon after the injury, and they're fairly predictable, sort of a time course that happens there. And we're finding out other things that may be causing those symptoms. Is there something else perhaps going on? And then we move into an exam, which includes both a physical exam, looking at the head and the neck, a neurologic exam, looking at vision and eye movements, looking at balance. We also do cognitive or sort of mental thinking type testing as well, where we're looking at memory, looking at reaction times, again, trying to assess the brain's function. We take all of that information and each individual piece of the puzzle, so to speak, to come up with the diagnosis of a concussion. Unfortunately, at the current time, there's not one test that allows us to make the diagnosis of a concussion or to rule out a concussion. Unlike if you fall down and break your arm, we can do an X-ray and the bone is broken or it is not. And with the concussion, we have to look at all of the information together to make that this decision and that diagnosis. That being said, we are certainly trying trying to research and determine, is there a blood test? Is there a saliva test? Is there some sort of a brain scan that can allow us to see a concussion, so to speak, and to know how bad it is. And so we are actively involved in research, looking at those various areas. But at the present time, it is what we call clinical diagnosis, looking at everything combined.
Dr. Miller, if I'm at a game and I'm observing something like this occur, what should happen?
One of the sayings that we have used for years is, when in doubt, sit them out and keep them out. And any athlete, whether it's a youth athlete at a recreational level or whether it's a professional athlete at the international level, should be removed from play immediately, evaluated, and not returned to play the same day, especially if there's a suspected concussion. Josh is talking about observing these, and there are challenges. He has years and countless hours of experience as a sports medicine professional on the sidelines. And even for us, when we are on the sidelines, it's hard to see these injuries happen all the time. But parents know their child better than anybody else. And if they are observing any of these signs, their child is reporting symptoms after an injury, and there's any sort of concern about a concussion, they should not go back. We hear all too often that a child is pulled to the sideline for evaluation. They're kind of checked on. They dust off a little bit of the dirt, and the coach says, "Are you okay?" And then, of course, the athlete says, "I'm fine. I want to go back." But that decision shouldn't be left to the athlete, who's typically a child or teenager, or to the coach, who means well but may not have any background or education in evaluating concussions. And so if there is an athletic trainer present, then absolutely that's great to have that resource. They are a wonderful resource when available, and can help make that diagnosis, or at least make the evaluation and make a determination on return to play, whether it's safe to go back or not. But in general, again, when in doubt, sit them out and keep them out. They don't go back the same day, and then they should be evaluated by a healthcare provider who has experience with concussions.
One of the most important conversations I bet you have is about how young athletes should be going back to school or going back to sports after a concussion. Can we talk a little bit about that?
Sure. I think that in the past, we had been more cautious and conservative about getting them back to normal activities. Normal activities meaning school, and doing daily activities with friends and such. And we found that it was not actually helpful, but it was harmful in the recovery. And so those that are held out from their school and normal activities for longer than 2 or 3 days actually feel worse and take longer to recover. And so we focus very much on returning to learning and getting them back into their school environment as soon as they can tolerate it, even while they're still recovering and still having symptoms. But what we're doing is helping make adjustments to the academic environment, and that can range based on the symptoms. But what we're really trying to do is partner with the schools, the educational professionals at this point, and enabling them to modify the learning environment. That may mean more frequent breaks during the day. That may mean more listening than reading. It may mean that they need to turn down the screen brightness on their Chromebook or their device that they're using. And that may change and vary throughout the day and throughout the course of their recovery, which can be modified by the educational professionals. But we try to partner with the schools and the teachers to re-engage and get the child back into their learning environment so they're not falling behind, and that they're back around their friends socially sooner than later.
What about sports, Josh? Do they just jump right back in when they're feeling better?
No, so they need to be symptom-free or back to their normal baseline. So we say that because not every kid has zero symptoms at baseline, right? Some kids have headaches or, light sensitivity just in general. And so we want to get them back to their normal baseline. And so when they're tolerating school, they're back to normal and they're cleared by the medical professional that they've seen, they can start what's called a gradual return to play. So we kind of gradually progress them back to activity, and each day we kind of increase their activity. So you'll do, generally it's 5 stages. So you have complete rest, and then you start progressing to some light aerobic activity to try and get the heart rate up. You'll want to complete that stage without having symptoms return within a 24-hour period. Then you can progress to the next stage. So you have to be symptom-free for 24 hours with normal activity and the physical activity that you've done before you progress to the next stage. And then, so we'll work on increasing the heart rate. Then we're going to do some sport-specific training, so sprints, change of direction, weightlifting, push-ups, sit-ups, that kind of stuff that stresses you a little bit more. Then we would want to do some non-contact sport-specific drills. So passing, shooting, dribbling, all that kind of stuff. I generally, reiterate to the parents that not by non-contact, I mean there should not be a defender going against them if they're working on something. So there's no increased opportunity to be tripped up or have a collision. Once they do that, then we can get them into some contact practice, and then if they've completed all of that without symptoms returning, then they can progress back to full play.
And I would add to that similar to school, there's been sort of a progression in how quickly we're getting them back to activity. And when I say activity, I don't necessarily mean back to playing full contact games on the field, but early on, years, not that long ago, actually, we had them doing complete rest, where they were not doing any physical activity. But you think about a lot of our young athletes and children who are used to being physically active, quite a bit, and we take away their school and we take away their sport and we take away physical activity. Again, we may be doing more harm than good, and so we are getting them back to some early physical activity, and that may be jogging, that may be riding an exercise bike, and then even progressing them a little bit quicker back into the safer levels of non-contact type activity than we used to be. And we've found that not only can they tolerate it, but perhaps it's helpful and beneficial in the recovery. So that's been a big transition over the past few years, is really not these prolonged restrictions from school and prolonged restrictions from athletic activity. And I think that's been a very positive change in the way that we've been managing concussions and is continuing to evolve.
We'll be right back after this.
For a list of common signs and symptoms of a sport-related concussion, visit scottishriteforchildren.org/concussion.
Welcome back to Checking In, a Scottish Rite for Children podcast.
What are some things you consider when you do think about returning an athlete to sports? Are there individual characteristics, or is it kind of this pattern for all athletes?
Absolutely individualized. This is a sort of a generic description that may apply to many of the athletes, but there are numerous factors that are going to weigh into our return to play decision, and sometimes we may prolong it. Sometimes we may return them to non-contact sports for a period of time. It depends on how long it's taken them to recover. It depends on how many previous injuries they have. It depends on their goals and what sport they want to return to. Where are we in the season? There are a lot of factors that go in, and so every patient or athlete that we are seeing, we are having that conversation with the athlete and their family, and sometimes the coaches or athletic trainers, in making a determination as a team about what makes most sense for this particular athlete. And the same thing happens at the professional level. The professional athletes, they're determining where they are, because you may have a very different approach if you're in season versus out of season, or depending on what position they play. There are a lot of things that we weigh in and work together, and sometimes Josh and I will discuss an approach that makes the most sense, and he'll help coordinate that, perhaps with the coach or the parents, or if there's an athletic trainer available, and we'll be in communication sometimes on an almost daily basis, making sure and seeing how they respond to some of the changes or the tweaks that we've put into the plan, and so it's not a go do this and you'll be fine. It's a sort of, we get feedback and then we'll change it based on how the athlete responds.
I can only imagine some of the other questions parents ask you when they come in for a clinic visit. Josh, can you maybe give us a few that we can get your responses for, so that we can clear up some confusion?
Yeah, I talked about this a little bit earlier, but one of the ones that we get a lot is, well, my kiddo still has a lot of symptoms. Shouldn't I keep them home from school in a dark room?
Yes, and that is a still not just from parents, but I still see that from medical providers and physicians that may not be as up to date on some of the changes in terms of our getting them back to things sooner. And so that is something that we are still encountering. We'll see a patient that's maybe 2 or 3 weeks out from their injury and is still not returned from school or to school. And you can imagine the stress that would cause on a young, maybe a teenager or a middle schooler who is now missed 2 or 3 weeks of school, or they're behind, not to mention the symptoms that they've been experiencing and they've been away from their sport again. Very, very challenging. And so again, we are trying to get them back sooner than later. And along those lines too, we'll hear a lot of times, well, they each time they go to school, their symptoms get worse. So how do they go back to school? And again, it's not an all or nothing approach. We'll make adjustments and changes there. But it does make sense that the more that the brain works, the more symptoms you're going to have. And the way I liken it to is if you have an ankle sprain, if you're resting on a sofa, it may not hurt, but you try to go run on it, it's going to make it hurt. Same thing with the brain. The more that you're using it, so the more load or cognitive load or more demand you're putting on the brain. So therefore, perhaps math class or a foreign language class may be even more challenging, which may cause more symptoms, but texting or some video games may not actually bother them that much. And so we get a lot of parents that will be a little bit suspicious, perhaps, that their teenager can text without any symptoms and can do just fine with that, but yet each time they try to do homework, their symptoms get worse. But again, that's not uncommon because of the amount of texting is a pretty mindless activity that doesn't require much demand versus algebra class certainly does for most of us anyway. It's a little bit more challenging. So we do certainly encounter that and allow them to do what they can tolerate. We try to find what does not worsen your symptoms and then avoid things that really make you worse, but let you do other things that don't.
One of the other questions we get a lot is, can wearing a helmet or a headband prevent a concussion?
That's another good one, and certainly we are observing a lot of the industry trying to develop technology and protective equipment devices to help reduce the risk of concussions. And I am hopeful that we are going to make some gains in those areas. And certainly there are some equipment that seem to be better than others at doing that. But there's not any concussion-proof helmet or protective headband. They have, for example, helmets were designed to prevent or reduce the risk of brain bleeds and skull fractures or cracks to the skull, and they've done a good job of that. But they were not initially designed to reduce the risk of concussions. And there was a recent study looking, for example, at the soccer headgear, because that's another one we get a lot about. Soccer players wearing the protective headband, and they compared a group of young soccer players who wore the headgear to a group that did not, and they found that the headgear did not decrease the chance of getting a concussion or the severity of a concussion when you sustained one. And so, unfortunately, there's not great data yet to show us that the headgear actually is going to make a difference in terms of reducing the risk of concussion. And one of the concerns that we have, we often talk about style of play, with the athlete. That's another individual factor that goes into our return to play decision, because a more aggressive player is more likely to get hurt and is more likely to injure somebody else. And if you have an aggressive player and you put a protective headband on them, they may feel like they are safer and be even more aggressive and put their head places where they otherwise maybe wouldn't. And so we want to help kind of minimize that as well. So again, unfortunately, we don't have any data to support the use of headgear, and football helmets and other helmets are getting better, but still are not able to prevent a concussion.
One of the other questions that we get a lot is, okay, so they've got a concussion. We've got a tournament in 3 weeks. Are we going to be back? Are we going to be ready for that? Because I watch on TV, and if somebody gets a concussion on Sunday, they're back playing the next Sunday. So it should take about a week to recover, right?
Yeah, you're right, and often it's almost phrased as, well, how long is this going to take to, and it's very challenging for us to predict how long it's going to take. We do see that it takes longer often than adults. Again, coming back to the concept that the brain is developing, and we think that teenagers do take a little longer to recover. And so the normal recovery is often days to weeks, with about 80% of kids recovering within about a 4-week period or 1 month. But that means that 20% or so are going to take longer than a month to recover. And there are some that bounce back just in a matter of a few days and seem fine, but it's very common for them to take several weeks. And so we will often hear, a week into it, well, they're still having headaches. Is something else wrong? Are we worried? And say that's very common for them to take that long. And we're not concerned if at a week out or 2 weeks out that they are not fully recovered. But the trend should be that they are improving. We want to make sure that they're heading the right direction, and the symptoms are gradually getting better. If they're not, then we often want to reevaluate and see if we need to make some adjustments to the plan. But unfortunately, we are not able to speed up the healing process, so to speak, to get somebody back for a particular tournament, and that is a very common. They have a travel tournament in 2 weeks. Will they be ready? We don't know. And so the worse that their symptoms are, that when they come in, oftentimes may take a little bit longer to recover. But even then, that's not a perfect way. So we do we have to let the brain heal. We want to make sure that they're fully healed before we allow them to go back and play. And unfortunately, it does not matter how important that tournament is or when it is scheduled. If the brain is not healed, then they are not going to be cleared to play.
What are some ways I can empower my children to protect themselves?
Yeah, so I think we need to encourage them to kind of know the symptoms of a concussion, and then to recognize that in themselves or in their teammates, their friends, and then to communicate that, to let them know that it's a safe space, that it's what's best for the player and for the team to keep them safe.
How can I help my young children understand what it is they're looking for, what they might feel?
Just to talk about some of the things that we've discussed here, what to look for in terms of, dizziness, headache, sensitivity to light, just kind of knowing those things. And then also knowing to recognize, hey, my friend Billy, he seems a little off. Like, he doesn't seem like his normal self. I need to let somebody know that.
Yeah, I think, headache is the most common symptom after a head injury, associated with a concussion, but not everybody that has a headache has a concussion and vice versa. But if they're experiencing any symptoms after a hit or blow to their head, or just not feeling right, I think speaking up and feeling supported and protected to be able to do that, and knowing that it's the right thing to do and that it's not a sign of weakness. As athletes, they tend to want to be tough and to continue to play, and they want to please their coach and not let down their teammates. And so we'll push through these injuries, either intentionally or unintentionally. And so setting that supportive environment and culture, I think, is really important.
You just mentioned the coach. I'm guessing the coach plays an important role.
Yes, coaches can be a huge role model. And so a supportive environment, and from the coach early on before the season, letting the athletes know that concussions are different and are not something that should be pushed through, actually makes a huge impact on the reporting of the injury and the way that an athlete or teammate may respond, versus a coach who is not as supportive. Then the athletes are much more likely to hide their symptoms and continue to play with an injury.
So we've talked a lot about things that parents can do, recognizing signs and symptoms of their athletes having an injury or a possible concussion. I know that I should make sure my kid doesn't return to playing after they have signs or symptoms, or we're worried about a concussion. Are there other things you want them to know before we wrap up today?
Yeah, it really takes everybody, right? So it takes the coaches, the parents, athletic trainers if they're there, and the kids buy in to communicate with one another. If something doesn't seem right, we've got to make sure that they're pulling the kid out and we're communicating.
I think it's really important, and as part of their management, once there has been an injury, if one part of that team is not on board, it makes it really challenging for us. And so making sure that everybody's on board, including, again, the school, the coaches, the teammates, the parents, and the athlete themselves, everything goes much more smoothly when you're all on the same page.
Well, I really appreciate you guys taking some time out to talk about sport-related concussions today. I know we have more information on our website about concussions, and we look forward to talking to you again in the future. Thank you.
Thank you.
Thank you, Brandy.
To learn more information about any of the topics discussed on today's podcast, check out our website at scottishriteforchildren.org. And be sure to subscribe to Checking In with Scottish Rite. This podcast is a production of Scottish Rite for Children. The host for this episode is Brandy Schmidt. Our producer is Maggie Dingwell. Our editor is Amy Krajewski. Our assistant editor and recording engineer is Stuart Allman. Our theme music was composed by Scott Holmes, and his music can be found at scottholmesmusic.com. Thanks for listening, and we look forward to seeing you at our next episode.